seems like you're having A-list celebrities on, talking to them about healthcare. What's the vision for that? Where do those two come together? It almost seems like the marriage of your doctor and celebrity thing. So,
the podcast space is really interesting because it seems like everyone is starting a podcast these days. Like you start seeing every celebrity, every athlete that just finished their career start a podcast. And I'm really excited to see where the space ends up landing because there's a lot of question marks about how long people are going to watch. It's a big time commitment to watch something that's 90 minutes or even listen to something that's 90 minutes. But for me, why it's interesting is it allows me exposure to those A-list celebrities, as you said, to highlight that they too have health problems so that you shouldn't feel isolated or sad that there's something wrong with your body because we all go through something as humans.
Okay.
And it's very unifying in that message. And the second aspect is celebrities and wealthy people in general oftentimes get really bad health care. And that is of in line with my thinking of the people on both ends of the spectrum, meaning if you're really poor, you get bad health care because you don't have access. You can't afford the medications. You might not have the best medications. You can't see doctors because you can't pay for them. And maybe you fall into some insurance gap. But then on the other side, the people who are very wealthy get bad health care because they get what they ask for, which is not always what's best for their health. So if they come in with a viral infection and demand antibiotics, doctors give in because they're a concierge doctor and this person is a celebrity, they're going to give them what they want. Or they get pitched executive health programs, which scan your entire body with a CAT scan and do an ultrasound of your carotids to make sure that you're not dying right now. Or they do genetic testing for Alzheimer's disease, which you can't act on because there's nothing you can do to mitigate that risk. So they get all of this extra testing. And the one thing that I can tell you as a practicing physician is more data does not equal better health outcomes.
Okay.
In fact, more unnecessary, unvalidated data yields bad health outcomes. So these celebrities are oftentimes getting tricked into getting better healthcare, more healthcare because they think they have more money, when in reality it's bad for their health.